Welcome. The Northwell Health Institute for Women's Health, Department of OBGYN, and Deaf Health Services, our staff interpreting department in Long Island, New York, would like to introduce this video on the OBGYN exam. The purpose of this video is to help you get acquainted with the various parts of a woman's health checkup and to hopefully answer some of your questions. The topics covered in this video include female anatomy, the GYN history and exam, and common concerns that may be discussed at the health visit. Let's get started. OBGYN stands for the area of medicine called obstetrics and gynecology. Doctors who specialize in women's health. Obstetrics, or OB, relates to the care provided to a woman during pregnancy, and gynecology, or GYN, is care provided to a woman when she is not pregnant. Doctors who are OB-GYNs usually provide both types of care. It is recommended that women have their first GYN visit in their teens, between age 13 and 18. When you come to an annual visit, you may speak to your doctor about anything related to your body and women's health concerns, and recommended standard testing to identify potential illness. Let's begin by talking about our first topic, the different parts of our female anatomy and how our bodies work. We will discuss 1, the female reproductive system, both external and internal. 2, other pelvic organs. And 3, the breasts. Outside, or the external anatomy, begins with the vulva, pictured here. The folds of skin here are called the labia majora and minora. Within these folds, you will find 2 openings, the urethra, which connects to the bladder, and the vaginal opening, which leads to the cervix and the uterus. Lower down, not shown in the picture, is the anus, which connects to the colon. In this side view, inside a woman's body, you can see the urethra and the vagina, leading into their respective bladder and uterus. Also see the anus leading into the lower colon. Internal anatomy, shown here, is the uterus, ovaries, and fallopian tubes. The job of the ovaries is to make hormones, important chemicals that tell the body when to grow, develop breasts, and have periods. The ovaries are structures. They contain tiny eggs, actually millions of eggs in each. Each month, one egg is released from an ovary. There are two tubes called fallopian tubes connecting to the ovaries and the uterus, one tube and one ovary on each side. The uterus has a lining that grows thick each month to support a pregnancy. If there is no pregnancy, the lining breaks down. This is why you have bleeding during your period each month. If a woman has unprotected sex with a male partner, the egg is combined with the sperm, then travels through the fallopian tube into the uterus. A pregnancy can occur. When a woman becomes pregnant, the cervix helps to keep the pregnancy inside until it is time to deliver a baby. The vaginal canal connects these internal female organs to the outside. Secondly, the different parts of our female anatomy or other pelvic organs include the bladder that holds your urine, and the colon that stores the stool. One last part of the body that is important to women's health are the breasts. Breasts are important for feeding your baby after pregnancy and can also be important for female sexuality and body image. It is important to be aware of your breasts and check them regularly yourself to make sure you do not feel any changes, such as a lump or discharge from the nipple. If you notice these changes, inform your healthcare provider. Our second topic will describe the GYN history and exam. When you first arrive at the office, your doctor will begin by asking a series of questions about your health history and personal and sexual life. During this part of the exam, they will ask you how many sexual partners you have, if you use birth control, and if you plan on getting pregnant. These may seem like personal questions. However, every patient is asked these questions. As part of the medical assessment. Your answers help the doctor to identify illnesses, such as cancer, infections, or disease, and to provide treatment if needed. If you are sexually active in all forms, oral, vaginal, or anal, there may be risks of sexually transmitted infections. Whether you are heterosexual or a member of the LGBTQ community. Everything you discuss with your doctor is kept confidential. The questions generally fall within a few categories related to your 1, GYN health, 2, pregnancy, and 3, general health history. The first topic is gynecological health, which are women-specific medical issues. For example, questions about your period. When was the first day of your last period? How often do you have your period? Do you experience cramps or heavy bleeding? If you are bleeding more or less than your normal, or at abnormal times, you should speak to your provider. If you think you could be pregnant or have any pain or any symptoms, now is the time to share them with your doctor. Other commonly discussed concerns include vaginal discharge, pain with urination, pain with sex, or breast pain. When the doctor asks you questions related to pregnancy or obstetrics, they will ask you questions such as, how many times have you been pregnant? Have you had any miscarriages or unintended pregnancies? Have you ever experienced any health problems while pregnant? Finally, you will be asked general medical history questions such as, do you have any health issues such as high blood sugar or diabetes? Hypertension or high blood pressure? Do you take any medications like pills, injections, eye drops, creams, supplements, or vitamins? Have you ever had surgery? Do you have any allergies? And if yes, what are you allergic to? Something that many people struggle to answer is whether there are any health conditions that run in their family, including both women and men. Consider asking your parents, siblings, and other relatives, like aunts and uncles, whether they have any health conditions you should know about prior to your visit, such as cancer, heart disease, diabetes, or high blood pressure. The next topic is the actual physical exam. Each time you visit the gynecologist, they will do a physical exam to check your anatomy. Some of the tests they do are to check for cancers, such as cervical cancer, or for any infection of the vagina or bladder. Your provider will start by taking your blood pressure and may listen to your heart and lungs with their stethoscope. The doctor will examine your breasts, pictured here, one at a time, with their hands to check your breasts for lumps or nipple discharge. This is very important to help identify any changes that could lead to more serious concerns or breast cancer. Next is what is called the pelvic exam, done to check your vulva, vagina, and internal reproductive organs. For your pelvic exam, you will be asked to lay back and put your feet in special holders. We call these stirrups. The doctor can then check the outside and inside of the pelvis. Depending on the purpose of your visit, the pelvic exam should not hurt, but you may feel some pressure. The pelvic exam has two parts. During the first part, the doctor will look at the outside and then insert an instrument called a speculum into the vagina to allow them to look inside. Pictured here. The vagina is already an open space. The speculum just helps the doctor to see inside the vagina and see the cervix. At some visits, starting in your early 20s, they will do a Pap test or Pap smear. The Pap test is obtained by using a soft brush to collect a tiny sample of cells from your cervix. This sample is sent away to a lab where they will look at it under a microscope to see if the cervical cells are normal. Common conditions a Pap test can identify are the HPV infection, changes in cervical cells, or cervical cancer. HPV, the human papillomavirus, is a common sexually transmitted infection from sexual contact that can lead to cancer of the cervix. Many people don't know they have HPV because it may not cause symptoms. Also, many people hear HPV and think HIV or HSV, herpes simplex virus. But these are not the same. But these are viruses spread by any sexual contact. For the second part of the internal exam, while still laying down with your feet in the stirrups, the doctor will place one or two of their fingers of one gloved hand inside the vagina, while their other hand is on your abdomen to feel the cervix, uterus, fallopian tubes, and ovaries. Changes in the size of the organs can be felt by conducting this part of the exam. Sometimes a rectal or anal exam may be indicated, especially if you're having problems in that area. Remember, the appointment is all about you and your specific needs. You may speak openly to your doctor about anything. It may be helpful to think about any questions you would like to ask the doctor prior to your visit and write them down to help you remember. Here are some things your doctor can help you with based on preventative medicine guidelines and recommendations. One, your doctor may offer you the HPV vaccine. Getting this vaccine may help protect you from developing cervical cancer. Your doctor can provide screening tests for common sexually transmitted infections, such as gonorrhea, chlamydia, herpes, hepatitis, syphilis, and HIV. You may not have symptoms with STI or sexually transmitted infection, and it is important to check. Condoms and dental dam use and all forms of sexual activity are barriers that can reduce the risk of sexually transmitted infection transmission. Do you have questions about sexuality, sexual identity, LGBTQ identity, or gender identity? You can discuss any questions with your doctor. Next, if you would like to get pregnant or would like to talk about birth control to prevent getting pregnant, your gynecologist can help. Examples of common contraceptive options include birth control pills, condoms, and the IUD pictured here. Depending on your age and exam findings, your doctor might recommend other tests, such as cancer screening tests. Your breasts can be checked with mammograms and ultrasounds at certain times in a woman's life to check for breast disease and breast cancer. You may also be referred for colon cancer screening, like colonoscopy or stool sample testing. Finally, do you have questions about transitioning to menopause? Commonly discussed concerns are hot flashes and vaginal dryness. A bone density test is typically recommended after age 65 to check your bones. A lot of information has been shared in this presentation. We would like to thank you for joining us for this introduction to the Gynecologic Well Woman visit. Remember, if you ever have any questions or concerns, don't hesitate to ask your healthcare provider. You and your doctor are a team. The goal is to help you stay informed and healthy. We would like to thank all deaf women, with a special thanks to those that are patients at the Northwell Health facilities that were the inspiration to create this video, so everyone can feel more prepared for their visit to the gynecologist. A very special thank you to the Katz Institute for Women's Health and Michael Kors for the Patient Experience Innovation Grant, whose support and funding made this video possible. Thank you.